overuse injuries, repetitive strain injuries, playing-related musculoskeletal injuries. These umbrella terms encompass a variety of very real problems for musicians. According to a 2019 study of 50 professional orchestral musicians, overuse syndrome is the most reported diagnosis among instrumental musicians suffering from playing-related musculoskeletal injuries. The study also found that 81.8% of these musicians had a perception of high demand associated with their profession. The high demand mindset of the musician can often prevent us from seeking out the care we need. We've been incorrectly conditioned to believe that if we're experiencing pain, it's because we can't keep up with the demands of our profession and somehow that makes us less. Unfortunately, we're also a little bit slow to put in the work needed outside of the practice room. And until our music educators are able to connect us to coaches and training that's going to help us manage our pain and our bodies, we're going to continue to suffer from overuse injuries, RSIs and PRMIs and all those other abbreviations. So let's get ourselves some education. In medical terms, an overuse injury, repetitive strain injury, or a cumulative trauma disorder is defined as an injury that occurs from tissue damage resulting from repetitive demand over a period of time. Most overuse injuries are traced back to two root causes. 1, ramping up engagement in an activity too quickly, or 2, engaging in an activity for too long without giving adequate time for rest and recovery. Although an overuse injury can happen to anyone, it's more likely to happen to you if you have a pre-existing condition or you're using improper gear. So make sure you're properly sized to your instrument and your equipment to reduce your chances at a cumulative trauma injury. Also, if you've taken a break, injury or heaven forbid a vacation, make sure you ease back into playing. Going from just 30 minutes every couple days to a 5-hour day of practicing, rehearsing, and performing is going to do way more injury than it is good. In fact, doctors suggest that you increase your physical activity by just 10% each week. Also, remember to cross-train. There's been a lot of research done lately on the dangers of being a single sport athlete, especially at a young age. Most of us start our instruments early, but now colleges and professional sports teams are actually avoiding recruitment of single sport athletes who've just trained in one discipline for the majority of their lives. That's because they have a much more likely chance of an early onset repetitive strain injury. But how many times have you heard musicians say that we're splitting our focus between two instruments when we should just be focusing on one? In fact, we've played and injured ourselves so much that we actually now have an acronym all to ourselves: PRMIs, or playing-related musculoskeletal injuries. Yay! These are chronic injuries that they started as just small aches or pains that we continue to play right through. And it's important to remember that all of these injuries are happening in the soft tissues of our body over an extended period of time. So we can do ourselves a great service by catching these small aches and pains and treating them before they turn into massive problems. So here's a really easy and gluten-free way to treat soft tissue injuries as they occur. Rice, which you don't actually eat. Instead, it's to help you remember to rest. The moment you have a pain, put down the instrument and go to the sofa and rest. Ice. A cold pack is going to provide temporary relief by limiting the amount of blood flow and therefore the swelling in the affected area. Make sure that you don't apply the ice directly to your skin, but wrap the pack in a towel before leaving it on for 15 to 20 minutes. Follow it up with C, compression. Wrap a bandage around really tight or invest in some sort of compression sleeve or glove. Lastly, E, elevation. Elevate the injury above your heart space whenever possible. This is going to help limit the amount of blood flow to the affected area. Remember, overuse injuries are inflammation-based injuries, and rice can help you cope with this. Lastly, familiarize yourself with the 4 steps to an overuse injury before your doctor needs to. They are 1, pain in the affected area after physical activity. This progresses to 2, pain during physical activity that doesn't restrict performance. Going on to 3, pain during physical activity restricting performance, And lastly, and worstly, 4, chronic persistent pain even during rest. The further down the list you are, the longer your recovery time. So keep small aches and pains from becoming chronic persistent problems that force you to take more time off than you want to. It is the best way to have a career of less pain and more music.